Shaq, you're one of the biggest stars in the world. You're a 4-time champion. Dr. Ofili, you're one of the top cardiologists in the world. What brings this partnership together?
Well, I met Dr. Ofili a couple months ago, and she gave me some information that I had no idea what was going on. 5.5 million Americans are affected by heart failure every year, but it particularly hits the African American community very hard. And, you know, she said that she wanted me to help get the word out.
How does heart health, how does it manifest differently maybe in African Americans as opposed to other races?
We have a significant disparity. The evidence out there from clinical studies that African Americans do have a higher risk in terms of getting the disease, but also more importantly, when they have the disease, problem with awareness as well as access to treatment. But we also know there are other differences in terms of what's happening with the blood vessels. How are you reacting? Some people know with a family history, maybe they're more predisposed to high blood pressure or diabetes. So all of that is significant interplay. The big message is to say to people, heart disease is still the #1 killer of everyone.
I think it's fair to say that most men, including myself, like I look in the mirror and say, I'm healthy, I don't need a doctor, I'm not going to check. Yeah. Just want everybody to go check with your physician, consult with your doctor, and just see.
You've been an athlete your entire,
so I don't,
you know what I'm saying, your entire life. If we were looking at risk categories, you could very easily say, I'm in the low risk category. I work out for, you know, a living, you know? And yet you're passionate about this.
Very passionate. Like I said, I'm passionate about the community. I realize that the older I get, I have to change my lifestyle a little bit. Let me go on the record and say I don't have heart failure issues. I don't have those problems. But, you know, I felt that I wanted to be the one to lend the voice to let people know, especially African Americans, this is really serious. We got to take it seriously. We got to start, you know, consulting with our doctors.
As we get older, we have these conversations about our health a little bit more than we did when we were younger during your
a little bit more.
Are you having these conversations a little bit more?
Definitely. I'm 47, and if I didn't have a conversation with Dr. Ofili, I wouldn't have known that heart failure affects African Americans community harder than it does any other group. Never knew that. And Doctor's a very intelligent woman. Throws a lot of big words. She gives it to me, I break it down for the people. For example, you want information on this, you go to ShaqGetsReal.com. Because when I was talking to her, she was throwing big words out, IMDb and
oh Lord,
clockamine and sockamine and all that. So I'm gonna be the guy to break it down for people.
If you could do one small thing, make one small change to help your heart health specifically, what would that be?
Well, I think it would be really important if you have risk factors to know what that risk is, right? So it's that checkup once a year.
I've been calling myself Superman since 17 years old, and I don't have a family physician. Never had a doctor. The only time I went to doctors when I had injuries, so I probably have to get one of those very soon.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.